Welcome back, dear viewers, and we have been talking a lot about creativity and giftedness and the importance of that, but also a very important topic is protecting our youth and our future generation from drugs and alcohol and different menaces that might affect their lives. And now we have a very distinguished guest with us here tonight, Dr. Mohammed Bardi, a consultant psychiatrist. First of all, we'd like to welcome you to our show.
Thank you very much.
Drug addiction, it's a very important topic. If we can talk a little bit about the percentage within the Saudi society, especially among teenagers.
Yes. Well, unfortunately, there are no clear statistics regarding the number of teenagers or addicts here in the Saudi Arabia. There are very limited statistics, but the good news is that there are several institutions that are already started to study these statistics regarding substance abuse and dependence and addiction, and hopefully these numbers will come out, which would help us a lot.
Mm-hmm.
However, we cannot neglect that the problem is present. It is here. We have it. We see it in our clinics. There was a small survey by the Ministry of Defense. They found that around 900,000 patients are being treated yearly. So these are the limited statistics we have, but hopefully we'll have larger numbers in the coming future.
Indeed, hopefully this is a very important thing that has to be treated before it infests more and becomes a big issue. So hopefully, if we can talk about why do young people use drugs and what actually attracts them to it?
True. Most statistics from the West show that the common age group that are the onset of starting addiction is the younger group, the teenagers or the young adulthood. And the reason in that there are several studies trying to find the reasons. Of course, the reasons of addiction are, just to clarify something, are two parts. First is the onset, starting the addiction, and then there's the continuation of the addiction. Now, the teenagers, let's talk about the onset, about starting the addiction. The major point is usually something called peer pressure. Because there are a group of boys together or kids, and one of them, most of them are trying, for example, smoking weed or something, and they tell their friends, "Come on, man, why don't you try?" And so he wants to, want to feel part of the group. So because of this pressure, they usually start using, and this will continue afterwards. Other problems that might initiate addiction is also the boredom. The teenagers, sometimes they're bored, they don't know what to do, because the teenage years are a very critical age. It's the age where they're creating their own personality, they're becoming independent. So sometimes they become bored and try new things, experimenting with new things like drugs, weeds, and alcohol. Another issue is the being rebellion against which is part of the independence. They want to become independent from their parents. They start to become rebellious, not just about addiction, but other behavioral issues. They start to become, defiant and difficult to deal with. So they start to become rebellion and try these drugs impulsively. And also, from one of the other causes of the youth using addiction is usually the absence of the parents' care or attention. If the parents are too busy from seeing or caring for their children and recognizing early signs of addiction or bad behavior, this would lead definitely to the teenager going to addiction. So I think the parents should be aware, and the family should be aware that they should take care of their teenage years, give them more care and attention, and detect the early signs of addiction.
Well, actually, this is what you mentioned is really conclusive. A lot of peer pressure. The kids mostly spend more time with their friends at schools and elsewhere, more than they spend at home and with their parents.
That's true.
Very, very important to actually be able to supervise that and know who the kids are being with. It's very important.
Who are their friends? Who are they going out with?
So if we can talk a little bit about what are the short terms of effects of drug use, and how does it affect within the short term?
Yes. Well, drugs, of course, they have short-term and long-term effects, and it depends on the drug itself or the substance being used or addicted to. Usually, the short-term is that depending on the substance, of course, itself, rather whether it's alcohol or weed or even stronger substances that are called.
Actually, I don't like to say stronger, but I think all drugs are equally strong and effective.
Yes, most of them are. Let's be clear that all drugs are bad for any individual. They should stay away from it. And that's actually some of the addicted patients, when they use something like light or like weed, they say, hey, I'm just using weed, it's not a big issue. They're all dangerous.
Indeed.
But I'm talking about the physiological effects. Some of them are less severe, but at the end, you're right. All drugs, we don't want to say that some drugs are okay. They're all bad.
People might take this like it's lighter, it's not as strong.
That's true, that's true. And actually, some of them do. Some of the individuals and the patient, they do say, hey, come on, it's nothing. They use it outside. So again, depending on the substance, the effects are usually, one of the immediate effects is changing in the mood and the behavior of the individual. For example, the person is usually calm, quiet person. When he takes the medication, changes his personality, becomes elated, irritable, euphoric, laughing inappropriately, so it changes the mood.
Mood swings.
Mood swings, sometimes, usually elated mood at the beginning, they're happy, and that's the effect that why, they continue to become addicts. This is a very, enjoyable effect.
So Dr. Al-Bardi, this is just like one of the ways that we can kind of spot out teenagers.
True.
If their moods have changed and their appearance changes and certain things change within our teens, then we can spot these changes.
That's true.
Like mood swings, but again, not typical teenage mood swings. They have to be particularly to your teenager's mood. You have to know them.
Yes.
And if their mood actually changes a considerable deal, then you have to look for these kind of signs.
That's true.
They could be using substances,
That's
alcohol
true.
or
Yes.
other...
You're absolutely right.
Yeah.
In addition to the mood, also the behavior. Usually he sleeps at 9 or 10, the usual, and suddenly there's a shift in his sleep, maybe because sometimes the substances can affect the sleep as well. So he becomes awake during the night, maybe asleep during the day, start to neglect his academics, his school, his homeworks, and one of the signs are staying outside the house longer than usual. So back to the effects, as we mentioned, the mood and the sleep, and sometimes affects the appetite.
So this is really something that I think it's a very important topic for all the families and parents out there, and especially to protect their loved ones.
That's true.
It's very necessary to be able to determine those signs and actually focus on them. But how can parents do that without invading their teenagers or children's privacy?
Yes, that's exactly a very critical area, very difficult to handle your teenager in general, not just about the... I think the best way is not to become too rigid, not to become too lean, just balance between the two. Yeah, becomes friends, but not not too much to allowing them to become free, but just get closer to them. That's the idea. Get closer to them, open your heart, open the communication between you and your kids. I think this is the best way. Don't shut the communication between you and your kids, and then they won't tell you what's going on. So I think coming closer, becoming friends, opening the communication, and being firm at the same time is a very good way to start to deal with the teenagers.
Well, Dr. Al-Bardi, we're going to move on towards a report, dear viewers, and hopefully that you will learn more about this very important topics that affects us very closely, and please enjoy this report.
How do people use drugs in the US, UK and around the world? The Global Drug Survey asked 15,500 people about their drug use, and this is what we found. More Brits admitted to trying cannabis than tobacco or energy drinks. This was true in the US as well, where 89% had tried cannabis. 15% of people said they'd taken a mystery white powder without knowing or asking what it was. A third of them had received it from a stranger, and under 25s were twice as likely to have done so than their older counterparts. Clubbers were slightly more likely to have tried most drugs than those who don't go out, but this was most marked for tobacco, with clubbers 34% more likely to have had a cigarette in the last year. While only 18% of British clubbers said they needed drugs for a good night out, more than half, that's 53%, said drugs could make a bad night out good. And in the US, 1 in 9 clubbers said they needed drugs to go out, and nearly half thought drugs could make a bad night good. But despite its reputation as a party drug, more than a third of non-clubbers said they used MDMA in the last 12 months. People are trying drugs in different ways. 1 in 30 respondents said they'd taken MDMA rectally. Lots of people say they use drugs heavily. A quarter of MDMA users take a full gram each session. Others said they usually take more. More than half of cocaine users think that street quality of the drug has fallen in the last year. Cannabis users like natural drugs. Most prefer natural cannabis to new synthetic versions, and they think it's safer too. People don't think police can tell if they drive on drugs. A third think police could tell if they were driving under the influence of cocaine if pulled over, or more for cannabis, despite a £2.3 million marketing drive warning of the dangers of drug driving. Police on both sides of the Atlantic routinely miss drugs during stop and search. The statistics in Britain are about 65%, and in America it's 70%. But what happens if you're found to be carrying drugs varies hugely. Only 10% of Brits found with cannabis were arrested and sent to court, compared with nearly half of Americans. The rules haven't made much difference though. Only 2% fewer US citizens have tried cannabis versus their UK counterparts. 21% of UK users of sleeping pills say they brought them through their drug dealer, only 6% fewer than got them through their family doctor. US doctors are far more likely to ask about illegal drugs than their UK counterparts. But UK patients are more honest. Only a quarter of UK drug users denied their use to a doctor, versus 40% of US citizens, and in both countries, women were most likely to fib.
Welcome back, dear viewers. That was a report on drug addiction, and with us to continue talking about this topic, we have Dr. Mohammed Bardi, a consultant psychiatrist. Welcome back, Dr. Mohammed.
Thank you.
Thank you for being with us again. So, Dr. Mohammed, before the break, we were talking about all the different things that can lead our teenagers to get addicted to drugs in the first place.
Yes.
And then all the signs that we can see or we can spot,
Yes.
possibly. But Dr. Mohammed, if we have a teenager or a friend or family member, whoever it is, and we
Yes.
spot that they are possibly addicted to narcotics or alcohol, how do we help them? Is, for instance, a drug addiction program the answer? And how effective is it?
Yes. This is a very important question, because I think this is the major area where families don't know where to go, how to start, and it's very necessary to treat the addiction. I think, as you mentioned, after spotting these signs, I think the first step would be trying to confront the teenager, not confront in an angry mood, but just confront him by telling him, look, we are seeing some signs and symptoms, we think you have a problem. Try to become closer. Yeah, let him open up and talk about this problem and admit that he's using. Some of them, of course, they will continue to deny. I think at that point, some firmness should be used. I think some usually things that we even use in therapy, we call something like behavioral therapy. For example, taking away something from the teenagers that they like, telling them we will not give it back to you until, for example, you tell us what's going on. Like
this is actually before identifying.
Yeah, before, even after, but yes, we use this before and after, but we're talking about before, that listen, you have to talk to us, tell us what's going on, or otherwise I will not give you, for example, your daily salary, or I will take from you your TV or whatever, or your car keys. So this might help the individual to open up and talk about his problem. After the confrontation, he has to be taken to addiction treatment specialist, usually a psychiatrist
Sure.
for treatment, and a psychotherapist as well. They need to enroll in the program. The program again depends on the substance being used. Some need something called detoxification, because some drugs after prolonged use, when you cut them immediately from suddenly from the patient, he will develop withdrawal symptoms, which some of them are troublesome and dangerous, like disturbance in the heart rate or drop in the blood pressure.
Yeah, some of them can be quite even fatal.
Fatal, that's true.
And maybe also suicidal. It's maybe have to do something that hurt themselves or something.
That's true. Yeah, that's a behavioral problem rather than the withdrawal symptoms. In the withdrawal, there's also some of them, like for example, alcohol and narcotics, the benzodiazepines, and they can cause, if you cut them suddenly, stop them
like
suddenly, seizures.
Like this,
They can cause seizures. So we have to detox the individual in an institution, a hospital. Usually we give him substitutional medications, or the same drug similar to it, and then start to taper it down gradually to control the withdrawal symptoms. So this is the detox period. Then there's another period we have to go on, which is starting the psychotherapy. We usually use cognitive behavioral therapy with these individuals, start to try to enhance their motivation to stop, highlight for them the negative consequences from using, break the feelings of denial, because some individuals have denial, either consciously or subconsciously. I don't have an addiction problem, it's no problem. So we have to break that denial as well. So we have to work with this psychotherapy really hard to try to reach the individual.
But how do you break this? How do you do that? How do you actually make them believe that this is affecting them?
Yeah, that's true. Again, this needs a lot of psychotherapy skills, and usually, as I mentioned, highlighting the negatives in the individual and giving examples of other addictive patients. Like, you think you don't have a problem, so what's happening to your academics? What's happening to your social life? What's happening to your physical health? Can't you see that this is happening to you? This might break the denial for them, but it's really difficult. You can't break it, I mean, easily for some individuals. You have to work harder and multiple visits and try to tell them, look, this is you have to realize the instinct of the problem, the extent of the problem, sorry. And then we can give examples. We've seen many individuals, look at these people who lost their lives, actually. So we don't want you to become like these. You have to stop now, otherwise you'll go into a much bigger problem.
Dr. Mohammed, I mean, that's definitely sounds very, very good. But what about, for instance, if an individual won't face his problem, or on the other hand, if they do go and they get treatment, what about the chances of them then relapsing? Yes,
and this is one of the biggest problems with individuals being treated with addiction. And in fact, I worked for a year in the United States in UCLA, University of California, Los Angeles, and there was a Dr. Richard Rawson and a Dr. Walter Ling. They were pioneers in addiction treatment research, and they concentrated many of their research on the relapse rate in these individuals. Among other research, of course, they are a very strong university there. So they found that the relapse rate is really high, and they try to find solutions or treatment methods that can drop or reduce the relapse rates with addictive patients. And some of those are continuation of the psychotherapy, or using some medication for certain drugs, continuous medication, not just for detoxification, but rather for the decrease the craving and the relapse. And they found that, also the duration of the psychotherapy, should we treat him like, okay, so he stopped, should we continue the psychotherapy, the follow-up for 6 months, for 1 year, for 5 years, for how long? So they found the longer the duration of the rehabilitation program, the better chance that he won't relapse. So really, I think it's a very difficult issue. It's a big problem with addicts, and I think bigger institutions, better psychotherapists, longer sessions, integrating programs of medications and psychotherapy are important to reduce the relapse rate. But it's high, actually. It's high if there are no follow-up of these patients. They will definitely go back. Another issue is from the therapist is to help the individual change his lifestyle. Most of these addicts have a lifestyle based around the addiction, about the drugs. Their friends are all users. Their timing, usually they use it, for example, they use it at night. The places all these, even the food, the way they sleep, all is programmed around the addiction. So they have to change that. The therapist should work to change the lifestyle by, for example, changing your friends, actually not having any contact with anyone who used to use, even if he stopped. Even, for example, the patient said, I stopped, I can go with them. No, even if you stop, you should not go with your friends. Start healthier activities, go to exercising and gyms.
Well, thank you very much, Dr. Badri. This is a very, very wonderful discussion. I believe this, that this is something that affects us all somehow. And
That's true.
Within family members or within people that we know, friends or loved ones, or even people that we work around. So it's really affecting the environment. God forbid that anybody falls in this trap. And we'd like to thank you very much for being with us.
Thank you very much. It was nice. It was nice being here. Thank you. Appreciate it.
Pleasure.
Dear viewers, now we're going to move towards yet another report about addiction, and hope that you will learn more about this very important topic.
Jackson, and all I wanted was to be loved. I only wanted you to love me, Mom, and I felt small when you yelled at me. As I grew, my friends made me feel unaccepted. Kids are cruel, they say. I wanted to be liked by people in school. No one seemed to care or notice. I tried to get close. I never felt part of them. The guys in the corner, they were cool. Made me feel nice. Made me feel accepted. I thought I finally found my place in the world, but something wasn't right. I looked for attention in all the wrong places. I tried here and there, but it was all bad. It all backfired. Now much older, I'm lost. Totally lost. I don't know how to get back. I wanted to find my way home, but I didn't have any friends that would help me. I tried hard, but I lost the battle. And all I wanted was to be loved.
True acceptance and love begins at home. If we make our children look for it, our children will find it elsewhere. Drugs, the biggest lie ever.
Welcome back, dear viewers. This is a very important topic that we have discussed here tonight with Dr. Al-Badri, and it really relates to our people that we love and we meet on our day-to-day basis, things that we do, and hopefully that we were able to bring you some of the information that might help you recognize this issue with anybody that is related to you or that you have any concerns about. And we just scratched the surface here tonight, and we will hopefully we'll try it in more episodes about this important effort. And we'd like to thank you very much with myself, Al-Azhari, and my wonderful colleague Camille, and I would like to thank all you dear viewers, and assalamu alaikum wa rahmatullahi wa barakatuh.